Pharmacists around the U.S. are sounding the alarm about hundreds of medications that are in short supply. Among some of the most concerning are shortages of chemotherapy drugs and those needed for ADHD, like Adderall. So joining me now on the set with more on this is CBS News medical contributor Dr. Céline Gounder. She's also the editor-at-large for public health at KFF. All right, so I feel like we were hearing about drug shortages, a few years ago. What's the issue? And is the issue the same for all the drugs?
So big picture, this is a market failure. But the particular type of drug that we're most concerned about are sterile injectable drugs because they need to be manufactured under especially careful conditions, sterile conditions. So that includes medications like your chemotherapy, normal saline, antibiotics, any number of medications. So there are a few things that drive this. One, the cost of building the manufacturing facilities. That can cost hundreds of millions of dollars. You, on top of that, have more demand for sterile injectable drugs like Ozempic, Wegovy, Mounjaro. So those companies, Novo and Lilly, they're buying up what little sterile injectable supply we have. So that's probably going to make these things worse.
Yeah.
And then big picture, even including, oral medications, generic drugs, you don't make a lot of money. So the companies are not incentivized to have a lot of extra bandwidth to create more. And a lot of the raw materials come from China and India, and that's a supply chain over which we have very little control.
And in particular, it seems like drugs connected to ADHD, that treat ADHD, they're in short supply. They've been in short supply for a while. What's going on with that?
Well, we've had a couple different issues contributing to that, in addition to what I just described.
Right.
That, applies to pretty much everything. But on top of that, there were some issues with labor shortages during the pandemic, for example. And so that limited how much they could manufacture. The DEA imposes certain quotas on manufacturing, which can also create some issues here. And then there's just been an increase in demand for medications for ADHD, like Adderall. So all of those factors, on top of just what applies to all medications, are affecting Adderall.
Thanks for correcting me, ADHD. So then, what do you do? How are Americans coping?
Well, there are some things that the government could step in to do. So that's typically what happens when you have a market failure like this. So, for example, utilities, where you have a natural monopoly, you have regulation to address some of that. So the Biden administration is looking at that. In particular, they are also looking at investing money in some of the raw materials you need for manufacturing the sterile injectable medications. They're investigating, FTC and HHS are investigating these middlemen that sell medications. So you have the manufacturers, you have the drug companies, and you have these middlemen. Are they creating some of the problem? And finally, we really need more transparency into the supply chain. So you see on the labeling, the company, the pharmaceutical company, you don't actually see the manufacturer. And so we don't have transparency into where along that supply chain the problems really are happening.
Right. Oh, that is so fascinating. Dr. Céline Gounder, thank you very much.